Good afternoon. Good afternoon, everybody, and thank you for tuning in. Happy New Year. I haven't been here since the new year. I want to start by acknowledging that on Friday, I was deeply honored to join President-elect Joe Biden to be introduced as his nominee for Secretary of Commerce. Our country is facing the worst economic crisis in a generation. We have millions of Americans out of work. But in this moment, as I have said so many times, in this moment of darkness, there's an opportunity to build back and build back better. To reimagine job training in a way that lifts up working families, to bring back manufacturing jobs that have gone overseas, to build a more resilient and more inclusive workforce so people have the skills to compete in our new economy. Those are familiar words that I have said many times to the people of Rhode Island, and they are President-elect Biden's vision for the Commerce Department. And if I am confirmed, it will be my great honor to lead that work on behalf of the incoming administration. As Rhode Islanders know, this has been my focus for the past 6 years here as your governor. My focus has been on, from day one, creating jobs, addressing the skills gap, and reimagining job training. So none of this work that the President-elect has asked me to lead is new to me, and it's what I've committed my life to for the people of Rhode Island over the past 6 years. The job training initiative that I started shortly after becoming governor, the Real Jobs Job Training Initiative, has helped 11,000 Rhode Islanders get the skills they need for new, higher-paying jobs. The Rhode Island Promise program has opened the doors for thousands of Rhode Islanders by providing them a tuition-free opportunity to go to the Community College of Rhode Island. Thousands of jobs have been created thanks to our investments in roads, bridges, and schools. And we've paved the way for future job opportunities by investing in innovation. In fact, right before COVID, Rhode Island had a record number of jobs and the lowest unemployment rate in 30 years. And when I ran for governor, we had the highest unemployment rate in the country. So together, we did fantastic work for the people of Rhode Island. We supercharged the Real Jobs model during COVID to invest tens of millions of dollars of our stimulus money into real jobs to be there to retrain and reskill Rhode Islanders who lost their jobs in COVID. And as a result, I'm so proud to say, we've already gotten 7,000 Rhode Islanders trained and back to work, folks who've lost their jobs due to COVID. In this unprecedented moment for our country, I believe that these initiatives that we have worked on here in Rhode Island together will provide a blueprint for how to rebuild America in a way that lifts up those who have been left behind. Now, I have been asked numerous times by members of the press if I wanted to go to Washington. And the truthful answer is I have never pictured myself in Washington. I have loved every minute of being your governor. It's the greatest honor that I have had in my life. I was born in Rhode Island, and Rhode Island is and always will be my home. I was born here. My children were born here. I was married here. And Rhode Island will always be close to my heart, where I am from, and my top priority. Having said that, the truth of it is we're in a situation as a nation that none of us ever imagined. And we are facing a dual crisis, a public health crisis and an economic crisis, unlike anything we've ever experienced. Certainly, the economic challenges ahead of us are like nothing I've ever experienced in my lifetime. So when the President-elect called and asked me to serve and really lean into this work of job creation and building back better at this moment of unprecedented economic crisis and asked me to help lead through this pivotal moment in our nation's history, I felt that I had to say yes, and it will be my great honor to serve the American people and continue to serve the people of Rhode Island in my new role as Commerce Secretary, should I be confirmed. Now, I want to be clear. This isn't going to happen overnight. The inauguration is a week away, and then my Senate confirmation process will take place after that. And in the meantime, I will remain as your governor. I will stay as the governor, continue to lead this state until the moment that I am confirmed. I want you to know I have daily phone calls, 7 days a week, with the leaders of our state's COVID response, which I have done continuously and will do every single day until I'm confirmed. I say that because I want the people of Rhode Island to know that there will be no disruption in our COVID response. We will not miss a beat, I assure you, in our vaccine planning, in our testing operation, or in any other part of the state's response to COVID. And thankfully, due to the immensely hard work of my team over the past 10 months, we have a well-oiled machine of a COVID operation around testing, vaccine distribution, contact tracing, provision of health care, field hospitals, which will continue uninterrupted. I've asked the Lieutenant Governor McKee, to join us today, and I'd like to thank him for joining us today. And in a few minutes, I've asked him to share a few remarks. I have every confidence in him and know that he is ready to step up on day one. I will also put your mind at ease and let you know that we have been in contact already over the past week, throughout the weekend, planning a seamless transition, and his team is meeting with my team on a daily basis already. I have asked the Lieutenant Governor to commit to keeping the COVID response team in place, and he has agreed to that, which is a fantastic news. So the COVID response team will remain in place, and again, it should give you great comfort that our response around testing and contact tracing and vaccines and field hospitals, the use of the National Guard, will remain intact, so this will be a seamless transition. The Lieutenant Governor has already started joining our COVID meetings and briefings, and I have complete confidence that he will hit the ground running and that the team that's in place is fantastic. Today marks the 125th time that I have stood before you at this press conference since the beginning of COVID over the past 10 months to provide you with an update. We started first daily and then 3 times a week and then weekly, but today's the 125th COVID press conference. During the time of the transition in the coming weeks, and for the sake of continuity, we're going to continue these weekly briefings. I've heard from many people that the weekly briefings are helpful. We're obviously also going to continue the daily emails. So if you can't catch the briefing, go ahead and sign up for an email. The format of these briefings will, however, be different starting next week. Dr. Alexander Scott and her team will continue to provide multiple weekly updates on the COVID response. Today we're joined by Dr. McDonald. Sometimes she'll be joined by Dr. Philip Chan. They're going to do a vaccine-specific briefing every single week. That's where we are now. Very important that we nail the distribution of the vaccine. So every week, Dr. Alexander Scott will take care of that. And also a general update every Thursday here at VETS, just as we have been doing, and she will continue to answer all of your COVID-related questions here at this press conference. Okay, I want to offer a few COVID updates, and then I'm going to hand it over to the Lieutenant Governor. After the Lieutenant Governor speaks, Dr. Alexander Scott and Dr. McDonald will offer a briefing, and then they will answer your COVID questions. And I also believe the Lieutenant Governor is holding another press conference tomorrow morning to continue to answer questions. So we'll begin now with the COVID update, as we always do, which is a look at the data. And if you could please put the data slide up on the screen. As far as it goes, this is a reasonably good news story in terms of the COVID data. Yesterday, we saw 823 new cases out of about 16,500 tests for a percent positive of 5%. I want to remind you that the last time I was up here, a couple of weeks ago, our percent positive was nearly 10%, much higher than 5%. So I have to say thank you to the people of Rhode Island for obeying the pause, for keeping it safe and local over the holiday. 5% positivity is where we want to be, and it's significantly better than where we had been 2 or 3 weeks ago and in the week leading up to Thanksgiving, so thank you. At this point, the virus has infected more than 100,000 Rhode Islanders and taken the lives of almost 2,000 of our friends and loved ones. And my heart goes out to everyone impacted. I have talked to many of you who've lost a mother, lost a father, lost a dear loved one. 2,000 Rhode Islanders have perished, and my thoughts and prayers and heart and sympathies are with each and every one of you. Rhode Island continues to lead the nation in testing. I'm proud of the fact that we've performed almost 2.2 million tests. That's the equivalent of more than twice our population. Last week, we tested over 100,000 people. To me, it seems like it wasn't long ago that I was here telling you we were going to try to test 400 people a week. Now we've tested millions, and we have a leading testing infrastructure in America. At this point, we're vaccinating thousands of Rhode Islanders every week. As of today, 7,446 Rhode Islanders have been fully vaccinated with the 2 doses, and another 38,197 have received their first dose. And we expect that pace to really increase in the coming weeks and months as manufacturers increase. That is fantastic news. The fact that we've already vaccinated, at least initially, nearly 40,000 Rhode Islanders, and we have a plan over the coming months to stay at a steady clip of vaccinating people it's just a fact that you can see the light at the end of the tunnel. Once we are to a place where everyone who's at high risk is vaccinated, you know, everyone in a nursing home, all of our healthcare workers, everyone over a certain age, we have much more flexibility on our ability to continue opening the economy without worrying that our hospital system will be overwhelmed. So I cannot emphasize enough, as Dr. Chan says, this is the beginning of the end of COVID. The vaccinations are here, and we have an excellent system to get them out, and they are highly effective. In the weekly data, the dashboard in front of you, you see 374 new hospitalizations. I want to point out to you that is the lowest number of new hospitalizations since mid-November. So again, we are not out of the woods, and I need everyone to stay vigilant. But I am relieved to see a 5% test positivity and the lowest number of new hospitalizations since mid-November. And I again want to thank our hospital leaders and frontline staff for your incredible work from day one. New cases per 100,000, another metric we look at, is slightly up to 752 as a result of increased testing, though, which is what we want to be doing. And again, I've already said, you see a big drop in the data before you in our percent positivity down to 6.6%, which is now the 6th lowest in the country. So I would say we're on a good path. I would say we're on a good path. Hospitalizations are stabilizing. Test positive is coming down. Test positivity, which is really what we look at since Rhode Island is so far ahead of the pack on testing, is in a much better place. So where do we go from here? Stay the course. Stay the course. We have, as I said, we have systems for testing, very, very robust. Contact tracing. We have no backlog right now in our contact tracing system. We have hired rapidly hundreds of people over the past 2 months. There's no backlog in K-12, which we did once have, or in the state's contact tracing system. And we have really ramped up our quarantine and isolation supports in the past couple of weeks. I can't overstate this enough. We now have a system which is reasonably seamless. You know, at the time you get tested, if you test positive, we can offer you support right then and there. Do you need a hotel if you are unable to live in isolation in your home? Do you need food delivery? So we have these systems. They are well functioning and robust. We have worked 24/7 over the past 10 months to operationalize and put those systems into place. And now we have to let them do their thing and stay the course. In the past month and a half, we have focused on increasing testing capacity, getting deeply into the hardest hit communities, leveraging new technology. Many of you, if you've been diagnosed, you see the text. We'll send you a text message, or we'll tell you you've been in close contact. We're increasing our access to the new treatments, which are highly effective, and of course getting vaccines. So the state, we have to stay the course with these systems, and everybody in Rhode Island cannot let their guard down. Stay vigilant. Keep wearing your mask. Stay socially distant. Wash your hands constantly. And we will continue to do testing, treatment, and vaccines. With that winning formula, we're going to get to the finish line in the coming months. I have been up here offering a message of protect your household. I'm going to continue to hammer home that message. After the pause ended, and the pause was very effective and well-timed right after Thanksgiving, so thank you, we started to slowly dial the economy back up with this framing principle of protect your household. Let's stick with that. You can go out to dinner. In fact, it's good to support local businesses. You can go to the store, you can do your errands, but please do it with the people you live with. You know, go to dinner, go to the store with the people you live with, and of course, wear your mask. As a result of the fact that it's working, I'm extending the current guidance for another month through mid-February. So the existing guidance, I'm going to re-up that executive order, and the existing guidance will stay in place for another month through mid-February. I want to make a special note about school sports. The existing guidance staying in place for another month impacts school sports. So I do want to say, very likely we'll be back out next week with specific guidance around school sports and youth sports. We're working very closely right now with the Interscholastic League to see if there are limited changes that we can make to school sports to allow the kids to play. So existing guidance in place for another month, with the footnote that hopefully in a week we'll have an amendment to that in coordination with the Interscholastic League that relates to school sports that allows the kids to play. And we're doing that also in coordination with Massachusetts and Connecticut and our neighboring states. I want to take a minute to talk about K-12. One of the keys to protecting our household is to get tested often. the last press conference before the holiday, I gave everybody a goal. Get yourself tested twice. Once, maybe once before Christmas, or once before the new year, or once after the new year. I hope you're able to do that. The good news is by early December, we were averaging 12,500 tests per day. I want to continue to urge you, please, get tested. Get tested, get tested, get tested. It's one of the most powerful tools in our toolbox to contain the virus. I'm going to set another goal here right now. We're at 12,500 a day now. Over the next month, we are doubling our testing capacity to 25,000 tests a day. We will have the capacity. Now it's up to you, the people of Rhode Island, to come out and get tested. It's on you to go out and get a test. In order to make it easy for you, we are launching more drive-through rapid testing sites where you can get your result within 15 minutes without even leaving your car. You're going to start to see more of those popping up, so it should be very easy. On your way home from work, stop by one of the drive-through centers, 15 minutes, get yourself tested. We're also working very closely with workplaces to bring testing to workplaces. And I want to thank the Chamber and the Rhode Island Manufacturers Association and other business associations for helping us access your members. We want to make it incredibly easy for you to get tested. At work, get a test. We're going to do the same thing in schools. You're going to see a massive ramp up in testing in the coming weeks at schools. We want to have regular testing of all students, all teachers in schools. It's what teachers and students deserve, and I want to thank the school leaders for working with us over the past 3 weeks. Again, we want to really ramp up the testing in schools and in neighborhoods. So one of the best things you can do as an individual, as a parent, as a student, as a teacher, as a mother, as a Rhode Islander, is to get tested frequently. And what we are doing on our end is making it easier and in your community. So again, we're at 12,500 today. A month from now, let's be at 25,000. To sign up for a test, take out your phone and go to portal.ri.gov. Portal.ri.gov. If you got tested last week, get tested again next week. If you got tested over Christmas, get tested again. If you go out for dinner with some friends and it wasn't your household, it'd be good if you didn't do that, but if you do, go get tested. If your kids were playing around with they come home and they say, Mom, I was with my friends, maybe I shouldn't have been, go get them tested. Portal.ri.gov. We're adding supply to the system. We want you to get tested. It's free, it's quick, it's easy, and it's an incredibly powerful tool. Last thing I want to say relates to schools specifically. Last month, we ran testing pilots at schools across the state. We tested in these pilots more than 900 students and staff. We found a percent positive of less than 1%. I want to say that again. We tested nearly 1,000 students and staff at a variety of schools last month, in the thick of this, and we had a percent positivity of less than 1%. So what does that tell you? Schools are safe places to be. That's just a fact, at least in Rhode Island. Due to the incredible hard work of the National Guard, the state team, the Department of Health, our command center, teachers, parents, principals, superintendents, schools in Rhode Island are safe places to be. And we're ramping up testing in the coming weeks and months. So as we start bringing kids and teachers back to the classroom, I want parents and teachers to have confidence that schools are safe. We've been at this now for months, and the proof's in the pudding that these are safe places to be. As we roll out the regular testing of asymptomatic people, teachers and students, schools will become even safer. We are giving the schools the training and materials to run the tests. And in some cases, we're sending them teams to do the testing. So if you're a parent or a teacher and your school hasn't yet announced their plans for asymptomatic testing, you should call them. We are, of course, not forcing schools to do this, but I believe every school should do this. And what we're doing is we want to make it as easy as possible to do it. So if you are a principal and you haven't yet figured out how you're going to be testing in your school, please reach out to us. Reach out to us. We want to help you. If you're a parent and you haven't heard anything about the new testing for your children's school, or you're a teacher, and this is news to you, you haven't heard about more testing and new testing, then you should call your school, because we are deeply committed to making sure that we have regular testing of all asymptomatic individuals in schools in the coming months. To the school districts that continue to not let their children into the schools, particularly the youngest kids, I'm going to ask you yet again to reconsider that decision. If you're in Pawtucket or you're in some places where you are denying your children their right to an in-person education, a high-quality education, particularly the youngest learners, I'm asking you again from the bottom of my heart to reconsider it. Schools are safe, less than 1% positivity, 5 months of data, and a whole new testing regimen that we are putting into place. And what we're going to aim to do is make it simple, easy, like a turnkey system for testing. That's what we want to try. To those of you that stepped up and did the pilot, thank you. It was incredible. And it actually was even smoother than we thought, which is great. So next, I'm going to turn it over to the Lieutenant Governor, who is here to join me. He's going to say a few words, and then we're going to turn it over to Dr. Alexander Scott, and then Dr. McDonald.
Governor, as long as you are governor, are you going to answer our questions? Governor, as long as you are governor, are you going to answer our questions?
So we'll get to that, and certainly I'll be available after my comments outside to ask the questions that you have on mind with me. But first, I want to just say this. The governor has done a great job for the state of Rhode Island and has worked very hard to keep us safe. And I saw her at a national press conference with the President of the United States. This is a source of pride for everyone that lives in the state of Rhode Island, to have a governor to serve in the cabinet of the President of the United States. So I thank you for your service, Governor. And for me, I'm in a good spot because your staff has been incredibly communicatively communicating with me and my office for 6 years. And over the last 10 months, that interaction has increased. So that has put me in a good spot in a transition. Transitions are not new to me. As a mayor, I became a mayor-elect, and I also became a mayor who had to make way for a new mayor to come in and take over duties in the town of Cumberland. I understand the dynamics of it. I understand the challenges of that. As a mayor, there was only room for one mayor at a time. As a governor, there's only room for one governor at a time. And we're going to work through the transition for the benefit of all the people who live in our state, all 39 cities and towns in the state of Rhode Island. Being here for a few minutes, I want to just thank the opportunity, as I've seen from a distance, my first time on this stage, but I've been watching. And we've been working to communicate with everybody in the state of Rhode Island during that time frame, doing our part as the Lieutenant Governor to get us through one of the most difficult and challenging health crises and economic crises that the state has ever seen. So I want to just thank our frontline workers, our nurses, our doctors, hospital staff for giving their all to save lives and protect our health. Small businesses are struggling like never before. And we're concerned whether or not they're actually going to make it through. And we need to continue to do everything we can to protect their families, their businesses, and the economy of the state of Rhode Island. Parents are concerned about their children's education. Our heroic teachers are rightfully worried about their safety. And everyone is wondering, when will a vaccine finally reach me? So as a lifelong Rhode Islander, a former mayor, small business owner, state official, I have always been committed to seeing this state succeed. And I want you to know that our transition process will be seamless, particularly when it comes to the pandemic response and the vaccine rollout. I've fully been briefed and continue to be briefed with the COVID team, and as the governor mentioned, that team is going to stay intact and continue to do that extraordinary work that they have been doing for the last several months. And I've spoken to Speaker Sakachi, Senate President Ruggiero. In the coming weeks, I intend to connect with our neighborhoods, neighboring governors to discuss how we can work together. I'll have a call with one of the governors this afternoon. And we're going to be a government that listens and works hand in hand with our partners in all 39 cities and towns. Because we all have the same goal. Governor Raimondo, Lieutenant Governor Dan McKee has the same goal: to build a strong future for Rhode Island. So I'll leave it at that. Today is about COVID. It's about the health of the state of Rhode Island. Dr. Scott's going to present information that's important for all Rhode Islanders to hear and see. I'm going to be available. I'm going to listen to Dr. Scott's remarks as in preparation to continue the education that I'm going to need to continue to do a good job as the governor heads to Washington and becomes a Commerce Secretary. So I'll be in the audience listening to Dr. Scott, and afterwards I'll be available to speak with the media outside. And tomorrow at 10 o'clock in the morning, we'll be down in Warwick at a small business having a press event, and we'll get into more detail about the issues that I'm sure are on your mind that you want to talk about today. Today's about COVID, today's about health, and we're going to do everything we can to make sure the people of the state of Rhode Island are safe, everything we can to get as many people vaccinated as fast as we possibly can. So I'll leave it at that, and I ask Dr. Scott to come up and give the presentation that we all need to hear. Thank you very much.
Good afternoon. Thank you for being with us today. I'm going to jump in with what we are all particularly curious about. It's our vaccination effort here in Rhode Island. I want to give a full update on where things stand with that. It's important to start with the understanding that the biggest challenge facing Rhode Island, like most other states throughout the country, is that we are not receiving a lot of vaccine supply right now in the state. That's our key component here. We have systems that are ready to go. We have the plans that have been developed. We need the supply to continue to push it out. We are doing the best that we can with what supply we have. As we get it, we are distributing it. The Centers for Disease Control and Prevention posts a map that ranks states by the number of doses administered per 100,000 people. Rhode Island is near the top. That means our systems are working, and I'm proud and grateful for the job that's being done. You can all be assured that as we receive the vaccines, our systems are in place to distribute it. As we've shared previously, we are getting roughly 14,000 doses of vaccine a week. When you look at our total population, that means 1.5% of our population each week. It seems like a lot, but it's that tiny fraction of our overall state population. And that is all we are getting for the week, with specific requirements even within that set allotment. We are posting data on our COVID-19 dashboard for doses administered. If you take a look at our day-over-day increases, roughly 2,000 doses are getting administered each day. Some days it's a little more, some days it's a little less. For example, yesterday we administered 2,920 doses. That's how we have our total doses administered of 45,643. When you think about 14,000 doses a week coming into Rhode Island, and that about 2,000 doses a day are administered, that means we're generally administering in a week around the same amount of vaccine that actually comes into our state in a week. This is an important point for all Rhode Islanders to understand. The number of doses coming into the state in a week is roughly the number of doses getting into the arms of individuals in a week. Getting those doses administered is a very operationally complex process. From beginning to end, it involves ordering the doses, having them shipped to our state, receiving them at the proper locations, redistributing them when they need to be distributed to other locations, then administering, along with many other steps in between. On top of that, once vaccine gets to a site where it will be administered, such as a health center or hospital or other clinical setting, patients have to get scheduled for appointments. That's a difference. We can't just have crowds of people showing up at once, given our COVID-19 pandemic. For that reason, the doses getting administered today arrived in Rhode Island a week or so ago. And the vaccine that we received on Monday of this week will get administered later this week or early next week because of those operationally complex steps that are in place. Because vaccine cannot get administered the exact day that it arrives in Rhode Island, there will always be a gap between how much vaccine has arrived in Rhode Island and how much vaccine has been administered. But everyone can be confident that the system to get that distribution going means that we equal what has come into the state is what has been distributed. As I said earlier, Rhode Island is actually doing well in the area of our system's distribution. To help illustrate this further, I want to make sure that this is clear because there's a lot of information that's out there. Up to this week, Rhode Island has received 72,175 doses of COVID-19 vaccine total. 16,757 of those 72,000 doses went straight to CVS and Walgreens because the federal government created a partnership with them to vaccinate nursing home workers, nursing home residents, and the residents of other congregate settings. Those 16,000 plus doses are not in our direct control. We are overseeing, ensuring that they are getting distributed appropriately and administered. But the ones that we are controlling is the remaining 55,000 doses that we manage and distribute as it gets out to the partners for administration. We coordinate when and where those doses go once they get to Rhode Island. So the number from that 55,000 is critical. Of those 55,000 doses that the state has been managing directly, 50,100 doses have been distributed to a point where they were or will be administered. That's 90%. That's why we are acknowledged as one of the top states in administering doses of vaccine. As a reminder, for the most part, the state itself is not overseeing the actual administration of the vaccine. We oversee the ones that are received here in the state and then distributed. We monitor the federal partnership program for distribution to our nursing homes and other congregate settings. Then we work with our partners to actually ensure the administration occurs. We're coordinating its shipment to places like hospitals, health centers, clinics for people in higher risk occupations, and other sites that we are being extremely creative and thoughtful about working with to gain access to vaccine. Generally speaking, the healthcare providers or organizations that receive vaccine from us after we distribute to them, they are taking that last step of the actual administration. That means working with the individuals that they're getting the vaccines into to schedule appointments, make sure that it's done in an orderly way, make sure that the reporting is done, and we're collecting that information over time. The priorities for the vaccinating we are doing now, which is phase 1 of our vaccination campaign, has been focused on healthcare workers and residents in congregate settings, and has also involved those individuals and more in some of our harder hit areas. I want to spend a few minutes talking about the fact that our prioritization has been driven by the data and the science, and let me tell you about that. Healthcare workers, as we know, are on the front lines of this pandemic, and we need to protect them so that they can protect us. That's in particular our healthcare capacity system. Among older Rhode Islanders and those in congregate settings who test positive, roughly 21% are hospitalized with COVID-19 if they are infected with it. And among people in our high-density communities who test positive, roughly 13% are hospitalized. In contrast, among the overall lower-risk adult population, fewer than 4% of those who test positive are hospitalized. That's an example of why the groups we have shared are in our phase 1 priority group. We want to focus on minimizing hospitalization risk and saving lives. We know for preventing spread of COVID vaccine, wearing masks, distancing, and washing your hands works. We want to focus on being able to preserve our healthcare capacity, minimize how many people are hospitalized, and save lives through our priority distribution of the vaccine. Within our broad categories of prioritization, I want to provide a little more detail on who is being vaccinated this week and who we envision being vaccinated next week. Please post the graphic with the populations being vaccinated this week for everyone to see. So I mentioned the vaccinating that the pharmacies are doing in nursing homes, and that is continuing this week. That's how seniors are our priority population, and recognizing that that's a population at highest risk of percent hospitalization. That's where we are focusing. By the end of this week, all nursing homes in the state will have been visited at least once. The pharmacies are going to be reaching out to each nursing home to make sure that there is a visit for vaccination administration, a total of 3 times. On the healthcare worker side, many hospital workers have been vaccinated and are receiving their second doses now. In the outpatient provider setting, we have urgent care staff and respiratory clinic staff who are getting vaccinated, along with individuals who are actually doing the swabbing for COVID-19 in those settings. We're continuing to also hold clinics for emergency medical services personnel, school nurses, and others. The Rhode Island National Guard, an invaluable partner to us throughout this pandemic response, is operating a clinic at Sockanosset for people who are doing COVID-19 testing, some pharmacy staff, and staff from our 2 alternate hospital sites as well. Some limited vaccinating is still happening in Central Falls, too. Please next post the graphic for the populations that will be getting vaccinated next week. For the week of January 18th, we are continuing with many of those same groups, again, based on the supply that we have. One big change is that we will be getting additional group home residents vaccinated, particularly individuals 65 and older, and people in elderly housing with residential services and assisted living facility residents. That is how we're continuing to focus on our senior population who is at high risk. The majority of the first doses coming in now will be used for assisted living facilities. As I was explaining, while we are administering as much vaccine as we get, we are usually administering the vaccine physically received from the previous week because of our operationally complex process to get the vaccines distributed to the appropriate locations throughout the state. Next week, we also expect some limited vaccination to happen for more of our outpatient providers. An example is an outpatient setting. An example of an outpatient setting is your doctor's office or your dentist's office. This group also includes our important behavioral health care providers. We want all of these outpatient providers to know that they have been prioritized as well. And while we had plans for distributing once we receive the supply for January 25th, we have been able to mobilize the adjustments that the strong team has put in place so that we can get started a week earlier. This is a large group, so we will be vaccinating this group for several weeks, while the other groups are continuing to be vaccinated. Healthcare providers in outpatient settings, as we get this process started earlier than previously shared, we want you to know that you don't need to take any additional action yet beyond completing the survey that has already been sent to you so that we could be ready once we were able to create this opportunity to start earlier. After we start with the healthcare providers in outpatient settings, we're going to starting vaccinating some of the remaining older adults more broadly. The vaccination of older adults altogether, which started several weeks ago, is continuing to happen incrementally. We started vaccinating older adults in congregate settings, such as nursing homes, since the end of December. We'll be continuing with residents of assisted living facilities and some other residence types, as I've outlined. We will need to take an incremental approach when it comes to older adults and our other priority groups because of the large size of the population and because of the limited vaccine supply that we are currently receiving. The next big step will continue to be sometime early next month, opening vaccine up for all adults, all older adults 75 years of age and older. We've already started that process and will continue to expand it. I want to take a moment to acknowledge that there was a lot of news yesterday about the federal government urging states to vaccinate people who are 65 years of age and older. we want to be clear that we fully agree with that. We have that prioritized. We want to get vaccine out to people older than 65 as well. We also want to move to individuals who have underlying illnesses. The key to understand is our system is in place and ready to do that. The limiting factor is not federal rules. It's not our approach in Rhode Island or what the systems are. The limiting factor is the amount of vaccine we are getting. Again, less than 2% of the population each week. What we receive, we get out. If we receive more, that's going to allow us to really get at the populations that we want to. For the individuals in Rhode Island, for example, who are 65 years of age and older, that is 190,000 people. If you know that we are getting 14,000 a week and 190,000 individuals is just one of the priority groups that we have, it is challenging to move any faster than what we are doing right now. But we want everyone to know how we are handling this. It would not be responsible or honest or fair for us to otherwise say to you, all Rhode Islanders older than 65, just go get vaccinated tomorrow. The federal government has said it. They haven't given us any additional supply to achieve it, but yes, go ahead and get vaccinated tomorrow. We just don't have the vaccine supply to do that right now. And we don't want to be irresponsible in how we're communicating with you. We want to make it so that when we say, yes, you can go ahead and get vaccinated, the opportunity is there. You know when, that scheduled time, right away, you're able to get the vaccine. Other states have approached it differently, particularly with the feds saying what they have said without giving the additional vaccine. They have said, yep, we're opening it up as well, knowing that there isn't vaccine available to provide for them. And so you see situations where older adults in Florida have been waiting in lines for hours, only to be turned away because vaccine is not available by the time they get to the front of the line. I have personal experience myself. I've spent hours on the phone helping with my mother who lives in New York. She's older than 65. New York has said that people older than 65 can get vaccinated. We've called, we've texted, we've looked and tried to get an appointment. Nothing is available for her for this week or at all for several weeks. What's resulting in many of these states and other locales is a lot of confusion and disorganization. Our focus is to make sure that we are upfront with what we have available, that we have our systems in place, what we receive, we are getting out, and that we're continuing to coordinate with our federal partners to give the additional vaccine that will allow us to increase vaccination to the priority groups that we would like to vaccinate. In Rhode Island, we are vaccinating older adults incrementally and thoughtfully. That means when we tell you you can get vaccinated, you will actually be able to go somewhere and get vaccinated, as opposed to just being, quote unquote, eligible to be vaccinated and then, be frustrated. We know that there is tremendous demand for vaccine right now. We are very pleased with that, actually. We understand why. It's been an enormously trying 10 months for so many Rhode Islanders, and we are glad that people are ready to get vaccinated. We want to continue to encourage that, so that as soon as we have the supply, we can make sure that it gets administered to the individuals that need it. After this virus has taken so much from so many people, we all see the vaccine as a way to keep ourselves and our loved ones healthier and safe. If we could, we would make sure that everyone got vaccinated right away tomorrow. But we need to get the vaccine supply in order to do that, and we need you to hear that we are doing everything we can with what we have. So please continue to be patient with us, continue to be engaged with us so that you're ready as soon as we receive the vaccine supply that we need. There is no vaccine wait list to get a vaccine. There's no vaccine sitting on a shelf anywhere in our state. As soon as vaccine is available for you, we will let you know through the press, on social media, and in a variety of other ways to make sure that you have access to it. I'm going to stop with that, with the encouragement that our winning formula, as the governor has shared, is vaccinations, expanded testing, and treatment. We want everyone to be able to access those resources and tools. As we have it available, we are building it to make sure the capacity is in your hands so you have what's needed getting through the finish line of this to be able to effectively protect your household. So with that, I'll stop, and Dr. McDonald and I will take any questions.
I've heard from some dentists who wondered why they were down on the team. I know everybody wants to get the vaccine. You can't have everybody up top. But given what they were exposed to, and they're in effect bathing in saliva all day long, I just heard from someone who said, what was the health department's rationale on not having them higher on the list?
Yeah, and dentists, along with the other outpatient providers, are a priority group for us. With huge credit to the dental community, with the PPE that they started with and have maintained, we have not seen a significant amount of transmission at all within our dental community, and we give them kudos and appreciate that. We know that we have them top on the list as soon as we get the vaccine supply, but we're encouraged with knowing that they have been doing what they need to protect themselves until we can get there.
Thank you. Doctor, you said you're getting out all of the supply that you have right now. But the federal government has said that they expect to increase supply. They're going to release some of the doses that have been held back, and production should increase. Do you have all of the staff and the process in place to use all of the vaccine if that supply increases dramatically in the very near future?
Yes, we would welcome that opportunity. Our partnerships with key stakeholders in the state, we have continued to engage with in preparation. We will trust that the federal government, if they increase what they send us, makes sure that the second dose supply is available to send to us as well. But we are ready to go. Our systems are in place, and we are agile, and we'll make adjustments as we have been doing to ensure that the 90% of the vaccine that we control gets out and into the individuals that we need them to receive.
The vaccine has been thrown out by your partners because they were not able to use it in time.
Not at all. We are completely on top of any additional vaccine that is available and immediately making sure that the next group in line has access to them. We are vigilant about ensuring that no vaccine is wasted.
Do you know for a fact that no doses in Rhode Island have not been administered, that have been thrown out?
We know that there have been no large groups, the way you're hearing in other states, of vaccine that has to get thrown out. We are monitoring the groups that are distributed to ensure that they are actually getting administered.
But small amounts might have.
That may be a normal part of the process, negligible, and it may be that that hasn't been the case. I just cannot tell you definitively myself. I can say that we have the process in place to ensure that no large volumes of vaccines are being wasted the way they're unfortunately hearing in other jurisdictions.
Doctor, can you share with the state why the governor wouldn't take questions today?
Josh and others are available to continue to answer any questions connected to the governor. We wanted to keep this focused on COVID.
Doctor?
Can you touch on the fact that Pawtucket last night voted grades 1 through 12 that they're going to have the children do distance learning, and they keep claiming that it's just not safe for the children in the Pawtucket schools. Can you touch on that? And should the teachers in Pawtucket perhaps get the vaccine to, it seems like a long time till the end of June that these children will not be in school.
Yeah, it's an unfortunate interpretation. We definitely understand the fears and concerns. We have shared again and again the layers of effort that have gone in to help reassure the teacher and school community of the safety of going to school in person, particularly for our younger students. We have the state-of-the-art Education Operations Center, only one in the country, most likely. We have a state-of-the-art K-12 testing system that allows for both rapid antigen and PCR testing available the same day for people who have symptoms. And now, for an additional layer, we are adding asymptomatic testing to be made available for students and the school community. And we have the data that shows we have not had significant transmission and outbreaks leading to multiple generations of cases within the school community. That structured environment really helps to minimize the setting. So all of those mitigation steps in place are enough for us to confidently say to Pawtucket and the other school communities that have understood this, that it is acceptable to bring particularly your youngest students back, knowing the challenges that occur for students who are missing that emotional, nutritional, educational exposure in person. The vaccine process, particularly as we get more supply, we're able to, because the mitigation steps that are in place in the education system are strong, we're able to focus the vaccine in its limited supply right now on the individuals who are at highest risk of hospitalization and ultimately death. That is not the case in our school community. As we get more vaccine, we have teachers and the school community in phase 2 as a priority group that we will be looking to move towards along with others.
Doctor, as a senior administration official here, I guess you're going to have to bear the brunt of the questions going forward about business openings. While all this is heartening to hear about the intense administrative effort to move forward with vaccinations, combine the fact that there's a potential that we will not have a governor answering to us for the next few months, and the continued collapse of the Rhode Island economy. So at what point in time will someone in the senior level like yourself address the fact that as we speak right now, businesses literally across the street are failing around us?
Yes.
There's a complete, what we've just been demonstrating here, it's a complete vacuum in leadership.
No, we have been addressing that directly each time we've come together, and really following up in terms of execution and implementation. When the federal funding had run out previously for being able to support businesses, we were one of the few states that had additional funding because of strong management available to be able to offer to businesses.
Is that true, though? Didn't you largely just hold on to money that was supposed to have been distributed to businesses months ago, and then almost like a sop thrown to them as a dying last gasp at the end of December? I mean, again, what are we doing now going forward to open up businesses so that people can earn a living, feed their families, and not fall into continued bankruptcies?
And so, yes, what I said was true in terms of our ability to balance what the federal government has offered to support businesses. When that ran out, we were one of the few states that brought in the funding that we had managed well to make it available to businesses. And now, because of what's been passed recently, there's additional funding available to businesses. We recognize that it is not easy. This has been the most challenging crisis for any of us of this time frame, and we know how important the economic health of our society is as a part of what public health is. And so we want to continue to balance what the federal government offers, be supportive to businesses, and be, as a proud Rhode Islander, supportive of knowing that there's going to be even stronger policies in place on the commerce side at the federal level as we go forward.
Doctor, in regards to vaccine rejection rates, are you seeing a lot of that in nursing homes in various places that are now getting vaccine doses?
As of now, 56 of our 84 nursing homes have been visited for vaccination at least one time. We will be doing, the partnership will be engaging in 3 full visits to each nursing home to allow for increased uptake of both the first and the second vaccine. After that process is complete, we'll be able to share a full picture of what we have in terms of the overall uptake. In the meanwhile, we are encouraging every nursing home resident, every nursing home staff to please take advantage each of those 3 visits of getting vaccinated. This was our group that we needed to ensure is able to be protected from hospitalizations and ultimately deaths.
Secondly, forgive me if this was already touched on, CDC expanded the vaccination guidelines to everyone over 65, Rhode Island 75. Any plans to change that?
As soon as we get additional vaccine supply, we are ready to expand. We would welcome being able to extend it to 65 and older. And as I shared, that's 190,000 Rhode Islanders. So just getting 14,000 a week is going to be challenging for us to just do that tomorrow. And so once we get more to the state, we'll be able to move into what we all definitely want to be able to do.
Clarify on the numbers as well. Thank you for breaking those down, the numbers of vaccines and doses, but I just want to see where these are kind of adding up. How many of that 38,000 that have seen at least a first dose already, are the nursing home residents counted in that number?
Yes, through the partnership.
Okay, so we're seeing then, 16,700 of those doses going directly to the pharmacies, and then 50,000, like you said, having been distributed to be ready to administer. It doesn't seem like it's adding up. It seems like there's a greater number than just the 14,000 that's coming in to keep on reserve. Do those numbers add up? Can you kind of explain that?
We can certainly talk more offline, but I think the heart of what you're demonstrating is that it seems like we're getting even fewer than what we're able to actually get out and administer. And that's really a reflection of the fact that as soon as we get what we receive, it's added to our pool, we are doing everything we can to get it pushed out. But we'll talk more on any details.
Thanks, everyone.